So what I'd like to do at this time is to present to you my dissertation research proposal, and it's titled Analyzing African American Clergy Perceptions of Evidence-Based Counseling Integration and the Efficacy of Faith-Based Mental Health Education. And so as a result, the African American Evangelical Church lacks an evidence-based depression counseling method that can be integrated with their theological and biblical beliefs. And there is a need for more research to understand if African American clergy are receptive to secular evidence-based counseling methods that will allow them to integrate their biblical and theological beliefs. The purpose of the study. So this study aims to analyze evangelical African American clergy's perceptions of evidence-based Christian secular counseling integration and the efficacy of faith-based mental health education. The significance of this study. This study will add to the body of literature in evidence-based practice, counseling integration, clergy counsel service delivery, and mental health education for African Americans. This study is significant because it could improve the cultural religious stigmas of the Black church concerning mental health care. And training African American clergy in evidence-based practice could increase African Americans' access to high-quality mental health services. And finally, this study is significant because it could introduce innovative ideas and processes for clergy-delivered counseling services. And now for an introduction to the background of my study. So the background of my study will include a brief overview of depression in African Americans, evidence-based practice, counseling integration, and faith-based mental health interventions. So research findings suggest the prevalence of depression and suicidal ideation among adults in the United States has been on a steady increase. And approximately 18% of African American adults 18 years and older experienced mental illness in this last year. And over 70% of African American adults that reported experiencing mental illness in the last year did not receive any mental health treatment during that time. To add to this, 40% of African Americans seek mental health care from clergy, use clergy as their primary source for help with depression, and are less likely to seek help from mental health professionals than any other race. And less than half of African American clergy are trained in professional counseling. So there are several researchers that suggest the following to us, that among African Americans, depression is a leading cause of morbidity and mortality. Suicide is the third leading cause of death for African Americans, male and female adolescents. And there's an increased risk of suicide in the United States among African American children under the age of 12. In 2020, suicide was the third leading cause of death for African American men ages 15 to 24. And African American women are among the most undertreated groups for depression in the United States. And now we'll talk briefly about evidence-based practice. So evidence-based practice has proven to be both efficacious and cost-effective for a wide range of psychiatric conditions, and this includes depression. Evidence-based practice integrates clinical expertise, the latest and best available research and evidence, and then it also integrates client, patient, caregiver perspectives. There are several researchers such as Hankerson, Barnett, and Faina that argue that mobilizing clergy to deliver evidence-based treatment is a feasible strategy to address the mental health disparities in underserved communities. And in addition to that, African American churches, according to the researchers, may be the most feasible options and well-positioned to promote evidence-based practice because of their cultural influence, accessibility, and clergy-delivered counseling to congregants. Evidence-based depression interventions, such as internet cognitive behavioral therapy, are treatment options that might make this alternative approach for clergy-delivered counseling possible. And training African American clergy in evidence-based practices could increase access to high-quality mental health services and improve depression treatment rates among African Americans. Continuing with the background of the study, I wanted to share just the definition of counseling integration, and it is the union or the coming together of biblical counseling and psychological theory where aspects of both schools of thought are appreciated and respected in the counseling relationship. And Kobaris defined this for us in 2017 in her research. Mental health educational intervention is training that aims to promote mental health and provides mental health prevention, etiology, and treatment education. Faith-based mental health training recognizes the value of intentional integration of faith-informed content in mental health education, as well as in health counseling programs. Now, for evangelical Christians, Scripture is the primary way that their distinctive beliefs and values about the conceptualization of mental health is revealed. So there are some concerns of whether a secular evidence-based therapeutic framework is compatible with the Christian worldview. And this is an urgent issue with profound implications among evangelical clergy. Now, Petit in 2019 argued that a sensitive search for common ground between these two schools of thought is a prerequisite to effectively mitigate mental health stigma and the widespread obstacle to treatment for African Americans. Faith-based mental health educational interventions may be that common ground for evangelical clergy because it's a culturally sensitive approach that can address the burden of chronic health challenges in the African American communities. So what I'd like to do at this time is to present to you my dissertation research proposal, and it's titled Analyzing African American Clergy Perceptions of Evidence-Based Counseling Integration and the Efficacy of Faith-Based Mental Health Education.